Everybody. Hi, everybody. We're going to give people just a few seconds to arrive. So we've got a lot of speakers and a lot of participants signed up, which is great. So we'll just be a few moments while our participants join us. Welcome to everybody. Hello, everybody who's joining us. We're just giving people a few seconds to join because we've got a large audience. So welcome to everybody who's joining. You can see our numbers growing. It's great that there's so many folks who are interested, and we're hoping you're all up for asking lots of questions. It's where we need some singing or dancing, Vicky. I can see that we have a hand raised. Perhaps, Nick, if you could put your question in Q&A. Yes, it definitely will be. Yes, I'll be making a comment about recording. So we're currently recording at the minute, and we'll be sharing this recording live on the website, and I'll be putting the web link in the chat. Well, we've got participant numbers growing, but I'm going to kick us off because it's 11:02 already. We've got a fantastic panel of speakers for you here today. So welcome to everybody who is joining us. It's really brilliant to have so many people interested in the topic of building the economic case for creative health and community-based approaches to health. We're really pleased to have you joining us. We are going to be recording today's session, and we've already clicked record, and this recording will be made live on the National Centre for Creative Health website. My name's Helen Chatterjee. I'm the Programme Director for Mobilising Community Assets to Tackle Health Inequalities, which is a UKRI research programme running across the UK at the minute in partnership with the National Centre for Creative Health. And I'm really, really pleased today to be joined by a series of fantastic speakers who are going to be sharing just really today some very brief details about some fantastic work that has been completed and also work that is ongoing. So it's really exciting to be able to all get together and share some of the ongoing learning around this very important topic of building the economic impact and evidence base around creative health. We've got 4 separate presentations for you. And so what we're going to be doing is moving through each of our speakers and their presentations. Some presentations have got multiple speakers, but there's going to be some time at the end for Q&A. And at the bottom of your screens, you should hopefully see a Q&A button. So please do, as speakers are presenting and thoughts, ideas, questions occur to you, please do post them in there. And then once we've finished all 4 presentations, I will be handing over to you guys in the audience to address your Q&A, and we'll direct those to the panelists. So I hope that all sounds great. We're really looking forward to our brilliant speakers. And we're going to kick off today. Our first speaker is Matt Bazzano, and Matt is from DCMS, Department for Culture, Media and Sport. And he's going to be presenting findings from their cultural heritage Capital Programme. So it's really exciting. And I think many of you will be familiar with the work that DCMS and the team there have been doing. So it's over to you, Matt, and thank you ever so much for agreeing to join us today.
No problem. Thank you, Helen. It's really great to be here. Thank you, everybody. Hopefully you can see my slides okay. Do shout if not. So yeah, as Helen said, I'm Matt Bazzano, Economic Advisor at DCMS, leading on the Culture and Heritage Capital Programme. I've not got long, so I'm going to very briefly touch on the programme and then talk a little bit about some work we did on monetising health and wellbeing benefits of engagement with culture and heritage. So start with a very brief introduction to CHC. So I always start right back at the beginning and mention the sort of Treasury Green Book. So this is a central government guidance on appraisal that we're kind of bound by, and that's the appraisal is the process of assessing costs, benefits, and risks of an intervention, and basically is a tool to use to help decision makers understand the impact, trade-off, and potential effects of different options and different interventions. So the crucial point here is that it's focused on the appraisal of social value. So that means we have to consider not just market effects, but anything that will affect the general welfare of a population. So this includes also making sure we're considering social benefits and cultural benefits, environmental benefits, all of those other things. And this became even more important back in December 2024 when the Chancellor made an announcement and said that every single pound the government spends will be subject to a line-by-line review, and basically to make sure that it's delivering value for money. So this sort of line-by-line assessment of all of the different benefits and costs that an appraisal was going to deliver became even more important. And well, what does that mean for us? So essentially, the creative, culture and heritage sectors are some of the few sectors that don't have specific guidance on how we can value their impacts, particularly during appraisal. So without this consistent approach, benefits are often undervalued or implicitly valued at zero. So what we're trying to do within the Culture and Heritage Capital Programme is develop a formal approach to measuring the full costs and benefits of culture and heritage in a consistent way. So that has the aim of making sure we're not just considering those economic benefits, but also going broader than that to capture wider welfare benefits that focus on sort of social impacts and cultural impacts. And that allows us to do a more kind of fully comprehensive appraisal and become more robust in delivering that sort of value for money element of that social cost benefit analysis. So the program itself is split into three parts. I'll only touch on this very briefly. So we have what we call the Culture and Heritage Capital Framework. So this is essentially the systematic framework we're putting together to allow us to identify benefits and measure the impacts systematically and in a consistent way across the board. We're then producing guidance and values that can be used for appraisal and evaluation. So we've got a bank of values that can basically be benefit transferred and dropped into specific cases. And then we're also producing guidance, which we hope one day will become supplementary guidance to the Green Book. And then on the other side, we've just started a piece of work to try and develop some culture and heritage capital accounts. So this will help us to monitor and evaluate culture and heritage over time and assess the value of kind of all of the services provided by an asset and all of their benefit flows. So as I mentioned, the framework itself, we're taking a capitals approach. So this is very similar to what's been done in the environment sector with natural capital. And this is seen from the perspective of stocks and flows. So essentially here, we have a range of assets. So these could be the built historic environment, it could be collection and archive, creative and artistic work. These assets produce services, so they can be obviously health services is one of those, but a broad range of things covering community services, identity services, just aesthetic services, having a historic building in nice condition and looking beautiful, and then those services produce benefits. So they can be the economic outcomes, but they can also be more social impacts, improving someone's quality of life, well-being, etc. And then what we're hoping to do for those is for each benefit, you can apply a metric, and that allows us to monetize each individual benefit flow to build that picture for the appraisal, essentially. So I just wanted to flag our sort of flagship publication, which we've called Embedding a Culture and Heritage Capital Approach. So this sets out the ambitions of the programme, provides guidance for application, and summarises all the research we've done to date. So do have a look at that. And 5 key points, I'll go through these very quickly, but as I've said, so welfare approach, we're considering all outcomes. It's not just for the public sector, but it's for any decision that's going to affect culture and heritage inside, the private sector as well as public sector. And it can be used to sit alongside a wider set of evidence to inform decision making. So qualitative, narrative approaches, expert opinion, etc. And it's economics led, but we also working with practitioners and other disciplines like heritage scientists. So now the last couple of minutes I'll just spend talking through some work we did with Frontier Economics on monetising the impact of culture and heritage on health and wellbeing. So as I'm sure you'll hear today, the link between culture and heritage engagement and the impact on health and wellbeing is well documented. There's a lot of positive that comes out of engagement. However, very few of these studies have taken the evidence and converted them to monetized values. which limits, obviously, as I said before, the impact in appraisal. So we need to make sure that we're conveying benefits in a language that's sort of amenable to decision makers and Treasury in the Green Book. So that's why we decided to do this project, so that we could use these benefits essentially in appraisal. And this is a very broad sort of overview of how we did that. So I won't go into too much detail here, but essentially the literature in this space, as I'm sure many of you all know, is quite fragmented. So we did a segment-based approach where we developed very specific models, taking the strongest available evidence, and focused on very specific cohorts of individuals, very specific engagement types, very specific health outcomes. So we haven't been able to develop a sort of single value of the impact of culture and heritage on health and well-being, but some of the models are more generalized than others, as you'll see. But essentially, the approach we took is we measured 3 different sort of elements of value. So the first of those was the individual impact. So these were generally monetized using QALYs and well-beers. So a QALY essentially combines how long you live with how good your life is in terms of health. And the basic idea is that one QALY is 1 year of life in perfect health, and they have monetary values attached to those. So that's the first thing that we did. The second thing was looked at health and social care impacts. So essentially, what is the health savings? What is that to the NHS? And then we looked at wider societal impacts. So it's the impact on people's productivity. If they're healthier, they work. They take less time off sick, and they're likely to be more productive. So yeah, that's kind of the approach that we took, and we produced per individual and society-wide impacts for each of these specific models. So these are just the sort of some of the models I've picked out to show here. So some of them look at general creative content, more to do with the participatory side, so things like painting, dancing, singing, etc., while others focus more on attendance, so going to a museum, going to a theatre. And as I said, some of them are very specific, look at different age groups. So some of them are more focused on young people, some more sort of over 65s. And they're all got kind of a very specific health outcome that they're looking at. So whether that be mental health, self-esteem, dementia, etc. And there's lots of variation, as you can see, across valuation, and some of that's driven by, some of them are very specific to a very specific cohort of people. So don't have much time to go through this in detail, but I think that the headline figure, if you like, from this report is the bottom line, and that's the benefit of general engagement for 30 to 49-year-olds engaging with culture and heritage every few months. And that produced, we found a health and wellbeing benefit of £992 per person, which when you aggregate that up to the cohort of people is a society-wide benefit of just over £8 billion, which isn't an insignificant amount. But I did just want to flag some sensitivity analysis that we did around that. So we were very much driven by the literature when doing this monetization in terms of the scope of people and the cohort of people kind of to use for the monetization. So that literature looked at 30 to 49-year-olds. We said, okay, well, what happens if the relationship holds with all adults? So we expanded this analysis out to look at all adults as well as, instead of just 30 to 49-year-olds. And that increases the society-wide benefits to just over £18.5 billion. So it is quite a sizable difference, and shows that culture and heritage has a huge impact on people's health and well-being. And then just to end, I did just want to flag another piece of work that was part of that project as well. So we looked at sort of benefits of engagement in people's leisure time, but then we also looked at the impact in a more clinical setting. So this looks at the impact of visual art therapy on pain and quality of life of individuals who are diagnosed with cancer. And we again converted these changes of quality of life to quality adjusted life years, and we use what if scenarios to try and monetize some of those benefits at a society level. So what if 5% of people diagnosed with cancer receive this type of therapy? What do those benefits look like? And some of the results are shown on the screen there. So really interesting work, and shows that this can be used as both kind of preventative thing, but also in a more clinical setting as well. So I've I know that was very, very quick, a bit of a whistle-stop tour of some of the work we're doing. If you want some more information, do visit our CHC portal or feel free to get in touch with myself or the team. We're doing a lot of really interesting work. We're planning on doing a lot more on health, but we're also doing some things on growth, social cohesion, cultural education, and lots of other things. So yeah, thank you for your time, and feel free to get in touch or ask some questions. Thank you.
That was super interesting. Thank you so much, Matt. And that's such a brilliant way to kick us off. I think not just the really impressive stats around that monetary value of arts, culture, heritage, but also I think really important for the sector is understanding, the types of data and intelligence that are required to kind of build these models and gather that kind of learning. So really helpful, brilliant way to kick us off. Thank you. And next up, we're going to be hearing from an Arts Council Wales report that was published quite recently. And then we know that very much draws on that work that you, Matt, and your team have done with Daisy Fancourt and Frontier Economics. So I think I'm going to kick off with you, Vicky, first off, and invite you to introduce the rest of your team, Rosie et al. So thank you.
So the invitation really should be for Rosie, who in her role as an Arts Council of Wales person, initiated this report. I came in as a researcher in arts and arts therapies to make sure that the health economic evaluations that were done by the Bangor University were rooted also in the arts and health field. I'm Professor Vicky Karkou. I am Director for the Research Centre for Arts and Wellbeing, and I'll come back later in this presentation to talk about some of the recommendations that we came up from this report. Rosie, do you want to say something about your role? You initiated this work.
Thank you, Vicky. Borodar Hugid have Enwy Rosie. Good morning to you all. I'm Rosie. I'm the Head of Arts, Health and Wellbeing for the Arts Council of Wales. And it's lovely to be here to share some of the results and the impact of this work that we've done with Vicky and Jacob and their teams around the economic impact of the arts on health and healthcare services, specifically in Wales. Now, we commissioned this report back in the autumn of 2025. And some of the questions we had in mind when we commissioned this were really, as an arts council, we have had a long interest in the relationship between arts, health and wellbeing, particularly in Wales. We've had some specific funding programmes that have sought to support particular projects working in healthcare settings. But increasingly, because we have a strong policy context around the Wellbeing of Future Generations Act here in Wales, we have been really interested in actually understanding the health and wellbeing benefits of all of the work that we fund as an arts council, and the benefits at a really a societal and population level from a health and wellbeing perspective, and increasingly from an economic perspective. And that really does speak to the challenging time that we've had around funding arts and culture, not just in Wales, but more broadly across the UK, I think. And the continued need for arts councils to advocate for as much funding as we can possibly get from governments into this work to make sure that we have a vibrant and thriving arts sector that we know will support the health and well-being of our population. But the questions that we'll always get asked, as particularly as a funder, is, well, can you show us the benefit of this in pounds and pence? What are you actually saying that what's the value that you're creating? What are the savings that you're generating for the NHS? And so we commissioned Jacob and Rhiannon at Bangor University, working with Vicky at Edge Hill, to really just say, like, how do we answer these questions? What can we actually say using the data that we have and the literature that's available? Is there a way of arriving at some numbers in terms of the return on investment of our portfolios of work, and also highlighting particular projects that have specific potential to have a monetizable benefit in terms of kind of NHS, social care savings, and creativity. So the question that we asked Jacob was, can we do this? Is this possible? How do we do it? And I'm really pleased to say that they came back and said, yes, we can do this. And so I'm going to hand to Jacob, who's going to take you through how they answered those questions and what they found.
Diolch yn fawr iawn, Rosie. Thank you very much, Rosie. I'm mindful we don't have a lot of time today, so I'm going to give a brief overview of some of the core work packages of the project, some of the key results, and then I'm going to hand over to Vicky to discuss some of the recommendations that have fallen out of this work. So this is the first ever assessment of the economic impact of the arts on health and healthcare services here in Wales, and we very much build upon the fantastic work shared by Matt and colleagues on the financial estimates of engaging in cultural heritage activities, including engaging in the arts, produced in the Frontier Economics 2024 report. In a brief overview, our project followed 3 work packages, each one getting a bit more focused as we moved along. So the first work package estimated the financial value of individual health and well-being and productivity benefits using the estimates presented that Matt discussed some of the methodology behind those, as well as the financial value of NHS and social care cost savings associated with all arts engagement across Wales. So this was using that population level estimates, not specifically looking at the Arts Council of Wales's own portfolio. But we did look at the Arts Council of Wales's portfolio in our second work package, where we used participation and attendance figures from across the Arts Council of Wales's multi-year funded organisations. These are organisations in receipt of core funding, or I think they're known as DPOs in England, just for transparency. We decided to use these because we had information on the Arts Council of Wales's investment into these core funded organisations. So we could then assess the relative return on that investment by using the financial benefits of health and well-being and productivity generated through the participation and attendance in those activities put on by those core funded organisations. And as Rosie alluded to, we then wrapped it all up quite nicely by looking at 4 core case studies that allowed us to demonstrate, from a financial perspective, the potential of different arts programmes across the Arts Council of Wales portfolio in addressing key health and wellbeing challenges across Wales. And I'm going to introduce some of the key findings from each work package now. So from the first work package, when we're looking at that population level estimate, we estimated that engagement in all arts activity across Wales is likely to generate at least £588 million per year. So this was using the largest estimate that Matthew shared, akin to the 8 billion figure that we see in the Frontier Economics report. Of this, around 500 million were health and well-being benefits specifically, and around 80 million were productivity benefits. We also then, in a separate analyses, applied the NHS and social care cost savings from the Frontier Economics report and estimated that all arts engagement has has the potential to save at least £26 million per year. Some of the methodological and data limitations presented in the Frontier Economics report, I would definitely signpost colleagues to the technical appendix of the Frontier report and also ours to say that, these methodological limitations, we actually believe these probably underestimate the real impacts. But still, as Matthew was saying, these figures are very much not insignificant and provide a real strong economic case for investment in the arts across Wales. When we then move on to the return on investment of those core funded organisations, as I said previously, we had investment data on the Arts Council of Wales's investment in these organisations over a 6-year period. We then used the per person attendance and participation estimates. Again, Matthew alluded to those. There's some differences between sustained participation and like active participation rather than just maybe more passive attendance, and the health and well-being benefits vary between those. So in the data that we had for these core funded organisations, we were able to sort of distill out those who were actively participating and those who were just attending some of the activities put on by those organisations. So when we applied those per person estimates of participation and attendance to participation and attendance figures across those core funded organisations, we estimated that for every £1 the Arts Council was investing in these core funded organisations, just over £11 were generated for the wider Welsh economy. Just to put this in some sort of context, a systematic review of public health intervention return on investments from 2022 estimated that mean ROIs for local public health interventions was around £4 for every £1 invested. When you expand that up to national level, I think it was coming in at around £14. So still really strong and evidence again on the return on investment. And as Rosie said, I think it's estimates like these. We all know anecdotally the qualitative evidence and the improvement that the arts and engagement in the arts can have on our populations, but this is the nitty gritty, and this is what decision makers will look at, is the bang for your buck, the return on investment. So yeah, we're really pleased to be able to evidence this through our analysis. I'm now going to present the 4 case studies, and importantly, these case studies were reflected of arts programs that were used across the life course. So we've got an example of the Dance to Health structured dance program, which is aiming to improve balance and proprioception in the over 65s to ultimately, hopefully, reduce and prevent falls amongst the elderly. We then had 2 case studies that looked at mental health in one population. There was the Arts Boost program. There was a therapeutic program for children and young people in West Wales. And yeah, there was an evaluation conducted that measured the changes in mental health and well-being through the Warwick Edinburgh Mental Wellbeing Scale, or the short version. We also then used evidence from a therapeutic craft program in North Wales that was targeted at individuals or adults living with mild to moderate mental health. And that evaluation also captured the change in subsequent GP appointments made after engaging with the program. So we were able to sort of provide some extrapolations based on that. And then finally, we included a case study looking at the health and well-being of our NHS workforce. I think it's great to be able to improve population health, but also I think the people that keep us healthy, we need to keep those healthy and well to enable them to fulfill their roles as well as possible, and to reduce sort of absenteeism that we know very much arises through burnout in these staff and big expectations and challenges placed on those through their challenging and taxing work. The final thing I'll say before going into the results is we chose these quite strategically because each of these was underpinned by a strong, robust evidence base. We wanted to be able to be confident in the findings that we presented, and each of the extrapolations we've made are quite conservative. I'll discuss some of the extrapolations we do make, but nothing is unachievable. And yeah, there's still significant economic benefits, but we feel these are grounded in reality and achievable outcomes. So the first one, the Dance to Health program. So this was based upon evidence from a evaluation conducted by Sheffield University of the Dance to Health program in England. So we've prorated and inflated those costs and applied them to the population of over 65s in Wales. We have assumed the prevalence of falls is the same amongst the 2 populations for transparency, but we estimate that this program has the potential to save £5 million a year in healthcare costs through preventing falls amongst the elderly. And yeah, we know falls in the elderly can have considerable comorbidity effects and then significant health and social care impacts in treating and managing those conditions. So yeah, Dance to Health was shown to have significant economic benefit. Secondly is the Arts Boost program, the creative activities for children and young people. And based on the improvement in mental well-being evidenced in an evaluation of that project, we've extrapolated up to say that if only 5% of the young people who referred to CAMS, children and adolescent mental health services in Wales, engaged in an activity such as Arts Boost, then we could be generating annual mental health and well-being benefits of around £9.5 million. So again, that 5% figure just being realistic. We know this is unrealistic to roll across the whole cohort, but yeah, I think even at a 5% uptake level, we can still see significant economic benefits generated. Going on to the adult mental health GP appointments, we chose this again because there was evidence in the literature of engaging with a therapeutic craft program having an influence on reducing the number of GP appointments after engaging in the service. But also there was some evidence from Mind the Mental Health charity that around 40% of all adult GP appointments were made for a reason pertaining to mental health. So there's significant demand here. And again, based on the evidence from this evaluation, we've suggested that if 5% of adult mental health GP appointments were avoided through engaging in arts-based activities, such as the Fathom Trust therapeutic craft program that we used the evidence from to inform this estimate, this could save the NHS in Wales up to £17 million per year. And the final case study result I'm going to discuss is arts program supporting the health and wellbeing of NHS staff. So this was based on evaluations of the musical hospitals program and the Coming to Our Senses program, both of which aim to improve health and wellbeing of NHS staff. And both evaluations also then considered the subsequent reductions in sickness absence rates among staff and absenteeism. So we've estimated that if interventions such as this reach just 10% of the NHS Wales workforce, then it has the potential to save the NHS in Wales up to £3.5 million a year through reducing staff sickness and attrition. So once again, we've been quite realistic in the uptake numbers, and again, we're still seeing significant economic potential of the arts in generating health and wellbeing across different populations across the life course. So I'm now going to pass on to Vicky, who's going to discuss some of the recommendations that fell out of this report.
Yes, so we have recommendations in Jacob, you'll move to the next one. Yeah, for policymakers is one set of recommendations. There is certainly a case to make on scaling up investment in the arts therapies and cultural activities. We know there are positive effects not only on health now, but we're growing evidence on the financial benefits on health and productivity. There is also a very strong economic argument for the benefit of the arts across the life course. The case studies that Jacob just described also provide additional evidence to that. It becomes clear that arts engagement can become an additional route to improving population health and well-being, which can reduce the strain on healthcare services, and the prevention on falls is a good example, very, very measurable example on how it can reduce strain on healthcare services. If we look at recommendations for researchers, so this report in particular, which is probably slightly different from the Frontiers economic report, is that we developed a methodology, and that's very much credit to Jacob and his team, on how we can use economic evaluations for nations comparable to Wales, in the UK, but also beyond the UK. So that's an interesting methodological recommendation that we can make from that report. Also, we need to start thinking about tools and methods that are needed to establish benefits across the life course, and we'll follow it up with the systematic review on for children and young people. Will pick up on some of these recommendations. We need to start thinking about standardized tools with minimal burden that can be part of routine delivery, and how to offer guidance to use that by in arts projects by arts facilitators. So that's the main recommendations. The other important thing as a concluding comment from this report is that there is a baseline created, which is an important reference point for how we can improve the quality of subsequent economic evaluations. In 5 years' time, given that this evaluation can be redone, there will be less reliance on external evidence, and more capacity to build the evidence from bottom up. So that's an important reference point to think about concentrating our energies into developing economic evaluations for the arts. And this is particularly relevant in the current economic situation, where there is a massive competition for budgets, need for an effective use of resources. So that's, I guess, key takeaway comments from this report. We have our contact details here for anything further that needs to be follow up. I am aware we are over time, but I wonder whether we close this with Rosie saying a couple of things about it. This report had a major impact, and I wonder whether, Rosie, you want to say something about the impact it had in Wales?
Sure, thanks, Vicky. yeah, it has been an incredibly impactful piece of work for us internally and externally. And there've been lots of brilliant things that have happened as a result of this report. You know, brilliant uptake in the media, and you know, people seeing it out there in the general public, which is always, if you can move the hearts and minds of the general public on this, then that's going to be what has the impact on kind of policymakers. But we've had a lot of direct interest from policymakers as well, Senedd members. Obviously, we've got an election coming up, so that it gives us a really useful way of engaging with Senedd members post-election in May. There's lots of useful recommendations around evaluation and how we support projects we fund to do that better, so that we can really continue to advocate. And lots of our NHS partners in Wales have also been incredibly grateful for just having such clear examples and such clear numbers that they can use to kind of quickly understand. We're very clear that economic markers are only one part of the picture. We really do continue to stress that. But having this has really been quite game changing for us. And I would say, I think the biggest and the final thing I want to say is that it shifts us as an arts council from just thinking about us as a provider of arts to also thinking about the arts as a key public health investment. So you invest in the arts, and you invest in the Arts Council, you're investing in public health. And so that's a message that's really easy for my chief exec to understand, and for us all to take out into our conversations with health leaders, with policymakers into the future. We know the evidence has been there for a while around that, but this has made it so much easier to make that argument. So I really want to thank Jacob and Vicky for their amazing work on this up till now, and for sharing the findings so well today.
Thank you, Rosie. That's such a brilliant way to end, and it's so fantastic to hear the impact that doing this kind of work can have at that kind of policy level, and those points you're making about kind of providers out there in the sector that need to kind of, yeah, what we should be evaluating, how we should be doing it. We're really interested in those conversations in this space, aren't we, about, you know, what does a national minimum data set look like? And that is the sorts of conversation we want to start picking up in these sessions today and going forward in the future. So thank you very much for that. That was really brilliant. I'm handing back over to you, Vicky, because you and Greg are going to talk to us now about some work that you're doing on the economic impact of working around arts and children and young people. Over to you.
So let me share my screen, if I may. So in parallel with this work, actually, we started before the Arts Council Wales report began with the work we're doing at Edgehill University as part of the Mobilising Community Assets call and the Arts for Us project. As part of that, we wanted to see what is happening specifically for children and young people. So we put a team together. We brought our very good friends from Bangor, and Greg is here with me today, who has done a lot of this work, as well as colleagues from other members of staff from my team, and Poissy has done a lot of work on this. Zoe Moula supported from King's College. Daisy had input in it, and of course Rhiannon, who is leading on the health economic evaluations in Bangor. So we looked specifically at the evidence we had across the globe on the economic impact of the arts on the health and well-being of children and young people. We did a systematic review, which is currently is under review in iScience. So we'll talk about background, methodology, and findings that Greg will present in a minute, and we have some recommendations coming from this systematic review. So why are we exploring the economic impact of the arts, targeting children and young people's mental health and health in general? There is an issue with the size of the problem for young people. Probably the majority of the people in this call will know that 1 in 5 children and young people are struggling with their mental health, who have problems with the mental health services and how they can accommodate and respond to need. There is a need to think about current provision, scaling up existing services, but also considering how we can mobilize community assets in a way that we can bring young people and the families closer to what is already available and link these community assets with health services. So the Arts for Us project that we received funding from the Arts and Humanities Research Council has been tasked to do very much that, to look at scaling up and linking place-based arts initiatives that support the mental health of children and young people. It's a large investment, 2.5 million, the largest study in the UK in art and art therapies for children's mental health, and involves collaboration of over 50 partners. We needed to ask questions like, are arts-based interventions effective in improving health outcomes? And we definitely, again, and in this call, probably the majority will agree that we do have evidence for that, and the answer is clear. As a researcher, I was very much tasked with the role to think about how we can provide evidence for those who are skeptics. One of the pieces of work we have done is evidence synthesis for through the umbrella review and meta-analysis on non-communicable diseases that you see the results here. So we have evidence for outcomes or all sorts of health outcomes from music, dance, drama, art, so on, but we have specific benefits for physical, psychological, cognitive, and quality of life outcomes. But none of this focused on children and young people as such. So we needed to look at a new systematic review and meta-analysis on mental health outcomes for children and young people that is currently under review. And also we needed to think about the economic impact of the arts for children and young people. So we know that there is evidence on the economic impact for these benefits, and we've already discussed the results we had from the Wales report. It is a lot of the estimates are based on a few studies. So gathering the evidence became important, which is why we did the systematic review on the economic impact of arts engagement for children and young people. So that's a bit of a long background for me to hand over to Greg to talk about the methodology, Greg, and how we came about it.
Thank you very much, Vicky. So hello, everyone. My name's Greg Flynn, and I'm from the Centre of Health Economics and Medicine Evaluation at Bangor University. So I'll briefly go through the methodology for this systematic review. We registered the protocol in Prospero first, and then the objectives we set out were to conduct a systematic review on the current evidence on the economic impact of the arts on the health and well-being of children and young people. We would also assess the quality of the included studies and grey literature, and would explore variations in economic impact across types of arts engagement, modalities, age groups, and so on. So next slide, please, Vicky. We searched 5 academic literature databases and also the grey literature, and that's just a snip of the search criteria there. This was also the search criteria used in the effectiveness systematic review that Vicky mentioned, but we updated item 6 to make it appropriate for health economics. Next slide, please, Vicky. And this is our Prisma diagram. So we identified over 10,000 results from the academic databases and also over 1,000 results in the grey literature, from which, after screening, we were able to extract data from 14 studies in total from the literature. As part of the objectives, we did review, we assessed the quality
of the reporting in these 14 papers. And because we had quite a lot of different study types, we used different reporting quality checklists. So that is the ACODS checklist for grey literature, an SROI checklist for social return on investment studies, and then 2 JBI checklists for randomized controlled trials and implementation studies. And finally, we used the Cheers 2022 statement to assess the health economic analyses we found. So these are some of the findings across art forms, settings, and designs. As you can see, from the 14 studies, 8 we identified were from the UK, and then we had studies from the USA, Ireland, Spain, Australia, Israel, and Sweden. There were quite a large varieties of study designs identified. So we had social return on investment, cost-benefit analyses, randomized controlled trials. We only identified one study that used a full health economic analysis, which was a cost utility analysis. And then the other literature were a mix of economic modeling, implementation studies, and then also reports to institutions that just used simple benefit cost ratios or program costs, as well as one study that only included qualitative quotes from stakeholders. There was significant variation in sample sizes, as you can see, from 20 children and young people up to modeling for 1.9 million children and young people. And the ages range from birth up to 29 years old in the primary evidence. And then also some of the arts were available to the general population or to people, children and young people with specific health needs, either mental or physical health needs. So some of the settings as well, as you can see, there are a range of settings that the arts programs were actually hosted in. And when we get to the findings in a bit more detail, we'll go through some of these in detail. So next slide, please, Vicky. So there was substantial heterogeneity in the primary evidence, and this prevented us from synthesizing measurable effects from the identified costs, outcomes, or valuation methods, or in other words, we were unable to undertake a meta-analysis for this systematic review. A range of outcomes were reported in all of the identified studies, so that were the most commonly found were well-being from societal benefits, found in 10 studies, subjective well-being found in 7, and then as you can see on the screen there were other outcomes reported such as self-esteem and externalizing behaviors and so on. And then some of the financial valuations used in these studies, the most commonly found were just simply costing the overall program. So studies would include how much a program cost to run. And then there were estimates for financial proxies or for outcomes, which is a benefits transfer approach, which Matt mentioned earlier on. And then also you've got the societal costs, some more niche aspects like social return on investment discounting and calculating quality adjusted life year benefits and so on. Next slide, please, Vicky. Across the 14 studies, we found that the financial benefits from arts programs outweighed the costs of investment, and that was irrespective of setting and population need. Society-wide annual benefits for the UK range from 122 million to 800 million pounds per annum, and that was the report that the DCMS prepared. We found benefit cost ratios range between £5.89 to £32 per monetary unit invested. And then social return on investment ratios were between 1.98 to 7 monetary unit invested. And the reason we're using this term is because sometimes it was in pound sterling, sometimes in euros, and so on. And then benefits were accrued to individuals, health systems, government, and society. So I'll quickly go through some of the results by arts modality. We found the most arts programs used a mixture of different modalities, but didn't disaggregate the effects from these programs. So we found 6 studies that reported on a mixture. There were between 1.98 to 32 monetary units invested per one monetary unit invested, and that was from social return investment analyses or benefit cost analyses. And then next slide, please, Vicky. I'll just rattle through these a little bit quickly. So we found 5 studies that used music programs. Interestingly, there were 2 RCTs, and one of those calculated that there were over 6,000 euros saved in healthcare costs avoided. There were 2 studies that analysed visual arts programs, and one of these studies in America, they'd started rolling out the arts program in several school districts that saved $170 per pupil. That cost $170 per pupil for a 7-week group art therapy. 2 studies analysed dance or movement programs. And this one of those was the full health economic analysis using cost utility analysis methods. And this was found to be 95% probability of cost effectiveness. 2 studies analysed theatre and performance programs. One of these was in Australia of a circus arts program, which had a social return investment ratio of $7 per each dollar invested. And then we found that the positive economic results were generated due to better school outcomes, which were modelled often, future lifetime earnings, improved health and well-being outcomes, reduced healthcare usage, reduced offending rates for programs in youth justice settings, and then wider societal benefits. Finally, from me, the quality assessments. As I mentioned before, we used 5 different reporting quality checklists due to the heterogeneity in design, population, intervention characteristics, and outcome measures. So these results should be interpreted as indicative rather than definitive. Having said that, most studies reported more than 80% of the items from their quality checklists. So that shows that there's strong methodological transparency in the identified studies. And then the findings from the more well-reported studies aligned with the findings from the less well-reported studies. And we decided that the economic benefits from arts programs are not merely an artifact of biased study designs. And I'm going to hand back over to Vicky now.
So a couple of slides from me on recommendations to finish that off. The idea of embedding health economics now in a number of different studies is imperative, and certainly that's the case for randomized control trials. We need to start thinking about reporting and justifying different stakeholder selection, sample sizes, the perspective of the analysis, and so on. Certainly we found that the studies we reviewed were primarily from the global north. Very few studies have taken place in low middle income countries. In terms of practice, and that's an important thing for discussion and further thinking through, we need to think about conducting routine arts program economic evaluations, including the economic impact of increasing or reducing local arts budgets. We need to start thinking about the generic quality of life measures for children and young people. AQ 5DY or 29D, the verdict is still out on whether the one of the two needs to be used. Well-being measures seems to be the short version of the Warwick and Edinburgh mental health, mental well-being measure seems to be a key one. So these are some of the practice-related recommendations that are important. Theoretically, we need to think about arts programs as complex interventions that need to follow an MRC guidance for how to evaluate and develop and evaluate complex interventions, and to think about insights from complexity science-informed frameworks, and also to think about not only on the impact of well-being, but also the impact of well-becoming. How do we weave in concepts like that within routine arts program evaluations or research studies with economic considerations? So concluding from this report, we found that the 14 studies all reported that arts programs benefited the health and well-being of children and young people, and benefits appear to be present regardless of modality, population need, or analysis methods. And while the quality of study reporting varied, taken together, the included studies provided strong support for investing in arts initiatives to improve the health and well-being of children and young people. Of course, we need more evidence. We need to think about how to increase and improve the quality of the research area and the quantity of the research in this area in order to support commissioning and policy decisions. So this is concludes this systematic review. I'm going to stop here.
Thanks so much, Greg and Vicky, for sharing that. Really fantastic to see the work that's been going on into producing that. And please do let us know when it's accepted and published. I'm going to whiz us through onto our final presentation, so that I'm very conscious that we have time for questions, and encourage you to please start populating. I know there's been some Q&A in chat already. I'm going to kick us off by sharing my screen, and want to welcome you to our presentation, which is frames, I guess, that the purpose of our webinar of a new work stream within Mobilising Community Assets. Vicky mentioned about Arts for Us, and for those of you that don't know, Mobilising Community Assets to Tackle Health Inequalities is a multi-phase, multi-year programme funded by UKRI, UK Research and Innovation, and led by the Arts and Humanities Research Council and a team of us at UCL, and in partnership with the National Centre for Creative Health, and we're your hosts for today. So really pleased to be able to work with lots of other colleagues across different organisations. And we have 12 projects live across the Mobilising Community Assets portfolio. You've just heard about the brilliant work that's going on in Arts for Us, and we have 12 other projects all over the country tackling different aspects of health inequalities with different communities, using different types of data, methods and partnerships to explore inequalities in their particular setting or area. So in this particular work stream, what we're really focused in on is building that economic business case, but with a real focus on thinking about a business case for creative health. And when we're talking about a business case here, we're really focused on thinking about that commissioning language and that commissioning framework, and a template that can really be adopted by providers, organisations and individuals when they're thinking about articulating their programme, their activity, their intervention to in particular kind of people in the health sector. We're talking really, I guess, about commissioners, funders, referrers and those individuals, procurement, finance people. And as you've heard already, I think a little bit from Matt, and we're going to be hearing from Daniel in our team in a minute, what that really means in terms of building that and articulating that economic business case. So today I haven't got much time, so I'm just going to give you a really brief overview of the work we're doing in this particular part of the programme. It's split into 3 work packages. In our first work package, we're really using that brilliant learning that's going on. You've heard about the great work in Arts for Us, and we've got that across all of our 12 different projects. We're gathering lots of learning and data and intel, what kinds of data, evidence and intel is out there across these systems and other systems where we know that creative health is very active. Daisy Fancourt and her team are really exploring the kind of evidence gaps, but also the opportunities in what we currently know about the creative health economics evidence base. And then I'll be handing over to Daniel in a minute, who's going to talk you through what it means to develop this kind of template business case for creative health that could be tested by those of you across the sector who are interested in that, and particularly thinking about that commissioning landscape. So just very briefly, using that brilliant network of networks, we have over 500 different partners, organisation and individuals involved in mobilising community assets as a research programme. And that just gives us a fantastic opportunity to kind of better understand those ecosystems and how they work together well, but also what some of the challenges are. And to do that, we're using a systems mapping approach. In this approach, what we're doing is using systems mapping really to understand what kinds of health participation data. You've already heard a little bit about what kind of data is needed to do this kind of economic work. But critically, how can we better link those data with the kind of local population health data and also the needs and priorities within those particular localities? We're also interested in those other kind of approaches to thinking about the health economic impacts of creative health, but particularly thinking about the integration of lived experience. That's a really key feature of mobilising community assets as a research programme. So I'm just going to whiz through. So unfortunately, Daisy can't be with us. Oops, sorry, today. So what I wanted to share with you here is just a little bit. Oh, sorry, I keep turning over my slides. I wanted to share with you just a little bit of the work that Daisy and her team have been doing. So Daisy is going to be is in the middle of conducting a systematic review, and what she's doing in that systematic review is, as you've heard, there's increasing studies, but still not as many as we would like, around the economic benefits and impacts of creative health, but in particular, what she's really interested in, health service utilisation. So she's going to be doing a systematic review of both grey and peer-reviewed literature to get a really good understanding of what do we already know, but then what are those gaps. She's also doing some work around, some of you may have heard of the Elemental data set, which is Elemental is a digital social prescribing platform. And what she's been doing, and what you can see here, and I won't talk in detail about these, but basically what you can see from these graphs is she's been looking at data, this is just from the past 3 months from Elemental. And what that shows is it basically matches up health service utilisation data with different types of creative health, social prescribing interventions, both before and after those activities. What you can see on all of these scales, we've got here GP attendance visits, we've got A&E attendance and hospital admissions, and those are reported from the people who have been engaging in this case, social prescribing, all sorts of different types of social prescribing initiatives. But what you can see across all of those graphs, hopefully, is that we're seeing a decrease in those types of health service utilisation.
I'm so sorry to interrupt. It seems people can't see your slides, Helen. I don't think we can see your slides.
Oh dear. Okay. Sorry to hear that. Let me try resharing. Sorry about that, guys. Did you see any of those slides?
I'm afraid not.
Oh dear. Sorry, guys. You should have heckled at me sooner. Rather than going back over them, I'm just going to start with this one. Is that okay, Daniel? Yeah, hopefully you can see. Sorry about that, everybody. I didn't realise that. That's one of the problems with not having a live chat. So what I was saying is about those data that are reported from participants in social prescribing against self-reported GP visits, A&E attendance and hospital admissions. Hopefully what you can see there, and this is data from over 4,500 participants from the Elemental data set, is hopefully you can see in those graphs a decrease in their reported attendance across those different areas of health service utilisation. So what I guess Daisy's main point really that she wanted to convey was obviously what we can share here is a direct correlation between participation and engagement in those types of social prescribing activities on health service utilisation. She was really clear to essentially say that we do obviously have to be very cautious about those wider longitudinal data. These are before and after from short interventions. But I think what you can see from that, and of course all the other evidence that we've been hearing today, is the impact that those sorts of activities non-clinical community-based activities can have on health outcomes. And in this case, health utilisation, which, as you've seen from the previous presentations, has a direct impact from a monetary value perspective. And on that perspective, I'm going to then hand over to Daniel, who can talk more about that aspect of the work. And I hope you can all still see screen sharing.
Yeah, that's great. Thank you. Hi everyone, great to be here. I've got a few slides to discuss one of the work packages I'm leading on. There are two elements to the work package, and the core part of that is to start to develop some guidance and templates for the creative health sector in terms of economic evaluation. And I'm thankful to Matt earlier on, who's actually covered a fair chunk of this, so I won't have to repeat too much of it. But the economic evaluation guidelines that we're developing are going to be Green Book aligned. That's our core manual in the UK around economic evaluation and social value measurement. At the heart of that sits cost-benefit analysis, or social cost-benefit analysis, as it's now come to be termed. And the key part of CBA is the identification, measurement, and valuation as many of the costs and benefits as possible of an intervention. And it's really important to hone in on the fact that the way that the Green Book does this, and the way that's done in kind of welfare economics, is that the ultimate outcome we're really interested in CBA is welfare or well-being, so people's quality of life. And within that, there are two types of benefits that we'd like to capture really around creative health programs. And it's great that Jake has mentioned quite a lot of them, I think, already in the evaluation he's done. But we have what we call a primary benefit, which is the direct impact on someone's quality of life. So that could be avoiding a health issue, reduced pain, better mental health, better self-esteem. All of those types of things are what we call primary benefits. They are non-cashable, non-financial in nature, and we have to go out and value those using non-market valuation methods. We then have spillover benefits from that improvement in health, which we call secondary benefits, and these are kind of more cashable knock-on benefits. For example, things like NHS cost savings, increases in productivity for firms where people are employed, etc. So it's those two sides of the coin that we want to pick up within this type of guidance. Next slide, please. And I'm here. I've got. Oh, that's not moving. Be able to move on, Helen? If not, I can share my screen. It might be better. Ah, there we go. Yeah. So just as a bit of interest, this is some initial work I did a while ago that looks at if we look at the kind of the cost burden of different types of health conditions, and I've just put 4 here. We can estimate the secondary impact. These are NHS cost implications of these diseases. And we can also look at the primary impact. These are the emotional quality of life impacts of living with these diseases. So the stuff in green is that more direct primary impact. The stuff in blue is that secondary spillover impact. The pattern that we get for most health conditions when we look at this type of data is that the primary impact is far greater than the secondary. So the impact on someone's quality of life of living with a health condition is quite significantly bigger than the impact that has on the public purse. So this image here is just really to set out that those two elements are really core, and we must really work on estimating these primary benefits as well, because they do take up such a large part of the overall cost benefit analysis. Next one, please, Helen. So why is economic evaluation important for creative health? Well, I think we know already today from a lot of the great debate that we've had, but creative health delivers multiple forms of social value. So there's the direct mental and physical health improvements. There are wider impacts in terms of community cohesion, social cohesion, connection, reductions in loneliness, all of that type of stuff. There's then an angle around participation for the individuals, enjoyment, sense of purpose, creative expression, all of these benefits for the individuals that participate. And there may be some other knock-on economic impacts as well. So that improvement in health and well-being may lead on to an individual going out and securing a job. So there may be those wider economic impacts as well. when we look at the type of breakdown of outcomes that we see in the literature, and I've got a slide on that in a moment, in creative health, most of them tend to be what we call non-market in nature. So they're talking about things like self-esteem, improved mental health, better well-being, etc. And they are hard to value, and the evidence tends to be fairly fragmented in terms of what we've seen. I think that the stuff that Vicky and Jacob have shown this morning is a really good exception to the rule of what we found, which is actually it's quite hard to come by, really rigorous analysis in this area. Without economic evaluation, I think creative health is really disadvantaged in terms of public funding decisions. And the key is that creative health is already delivering social value. We can see that from qualitative and quantitative evidence. And so this framework that we're developing will really help to ensure that that value is measured and evidenced in public policy decision making. Next slide, please. So this is a very initial draft of the type of structure of the guidelines that we are looking at, and they're very much up for debate at this stage. We will be working with stakeholders, yourselves in the sector, in the field, in terms of getting buy-in, review, etc., to kind of finalize them. But the broad aim is that we will be developing a Green Book aligned framework for economic evaluation in creative health. The use for that framework and guidance will be an options appraisal, which is the primary use case for the Green Book. That is where you have a series of options for delivering certain types of outcomes, and you're wanting to choose the policy option that delivers the most social value. So that's an ex-ante assessment. But the framework can also be used to assess single standalone interventions, activities, or programs, both in the future ex ante or that have happened in the past if you've already got the data there. So that there's an ex post angle to it as well. The core components that will make up the guidance starts out with a theory of change. So that's a core recommendation for us, that we develop a theory of change within creative health generally, and that any intervention looks at that more specifically for a specific program. So for example, if it's singing related or arts related, you can use the structure that we developed for the theory of change, but adapt that to your specific participants and types of outcomes. And that will take us through kind of the inputs and the activities, like a dance class or a singing lesson, all the way to what those outcomes are. Is it better mental health? Is it social connection? Is it reductions in NHS costs and things like that? The next element then is really to put meat on the bones of this theory of change. And the first step to doing that is to measure the impact. So we've got what we think is this causal pathway from the theory of change, but it's absolutely critical then in terms of the application of an economic evaluation that we can measure those outcomes and attribute the changes in the outcomes that we observe to the creative health interventions. So, for example, pre-post data is very useful, but it won't give us the full story because some of that change would have happened anyway. So we're really thinking about what the counterfactual is and how do we get, as causal estimate as possible. And for that, we're going to have to be looking at various types of statistical methods and a little bit of a hierarchy in terms of the rigor. And we've heard today already methods like RCTs, that would be a gold standard, but there are other methods within the Green Book that would be permissible around counterfactual and control group types of assessments. Once those outcomes have been measured, the next step and the core step really in cost benefit analysis and social value is the measurement of the costs and benefits in monetary terms. And that will allow us to aggregate over a certain program or an initiative to understand the full impacts on society. And so we'll have some guidance around that, and then how to present the results from this. So we've heard a lot today about benefit cost ratios, return on investment ratios. What do those things mean? How should they be presented? What should the cost denominator be in those equations? And all of the type of guidance around presentation of the results. And so the aim is to have that as a standalone document, but sitting alongside that are some templates that we're aiming to develop, and they will really help the sector to robustly report on their kind of economic evaluations. And these templates will cover things like standardized sets of metrics and outcomes, that lead onto a data collection template, guidance around costs. So a really core part of measuring these cost benefit ratios is to fully account for the costs of running the program. So what do we do with the volunteer time input, for example? We're going to have some guidance around that. Then some unit costs and values that are standardized. So the standard value, for example, of a reduced hospital stay or an improvement in mental health, for example, we'll look to start to standardizing some of those unit values so that the sector has a really consistent way of doing that. And then some templating on the reporting. Next slide, please. We've done some analysis on some of the outcomes that we're seeing reported in the literature, both from kind of qualitative focus group types of analyses as well as quantitative. And I'm really happy to see today that a lot of these outcomes have been mentioned in the evaluations that have been conducted. And what we want to do is really recognize that there are obviously core health-related outcomes, and they are going to be these primary benefits as well as the secondary benefits in terms of reductions in medical usage. But we do also have what we call these kind of non-health related outcomes, which is more around reductions in isolation, loneliness, strengthened community engagement, creative skills, etc. So with this table as a basis, and if you can go to the next slide, please, we developed initially a data template that we are testing within the sector at the moment in terms of what type of data is currently being collected. So we put together some guidance based on that previous table, asking different organizations. And at the moment, we have data back from 9 programs, creative health programs. And what we're finding at the moment is that 81% of the questions about the program are covered. So we've got fairly good coverage as business as usual in the sector in terms of what the type of activity is, where it's being done, the delivery organization, the duration of the activity, etc. When we then get to the participants, so we need data on the participants' background and engagement, etc., to do these impact assessments, that drops quite significantly. We're finding that only under half of the organizations have sufficient data on their participants and their background. So things like age, gender, employment status, and income, background, that type of thing. And then, unfortunately, as we then look at the kind of the outcomes within that table and the types of outcomes that we need for a full economic evaluation, we're only finding that about a quarter of the programs assessed so far from the returns to our data template have the type of data that could be used in an evaluation like this, covering elements such as mental and physical health, social outcomes, so that's kind of loneliness, connections, etc., and use of healthcare services such as GP visits. And the last slide, please, Helen. And so I'll leave you here with something that's in very much kind of draft at the moment. And this is kind of getting to a point where do we think the sector could go to in terms of a set of outcome metrics to measure consistently creative health interventions. So these are metrics that are guided towards input into economic evaluation. We recognize that they don't cover absolutely everything. There's a lot of qualitative stuff that's missing, but they are the core metrics that would guide us in order to be able to deliver economic evaluations of these types of interventions. So we've bracketed them into 2 camps. We've got the core metrics and then additional. The core are such because they are the ones that there are valuation methods out there that allow us to put a financial value on these, whether that's the quality adjusted life year, the well-being, a stated preference, or a reveal preference valuation method, all of which sit within the Green Book guidelines. And we are able to attach values to these types of outcomes. So these core metrics cover both the health side, QALYs, for example, health conditions. And in terms of QALYs, we may look at EQ5D. I think Vicky was mentioning that there are other forms that we can map from health states onto QALYs in addition to EQ5D, such as SF12. There are lots of options that we have there, but I think a QALY is a fairly standardized metric that we would like to account for, as well as other types of health conditions. Then within the kind of the social and the wellbeing realm, that picks up more of the non-health types of outcomes. So these would be things like the loneliness, personal agency, participation, life satisfaction, etc. And then some economic based outcomes. These are increasingly being looked at in the sector in terms of employment and productivity, and then service usage. So all of those 4 areas, they are just kind of the broad categories, and metrics sit under that. But those types of metrics would allow us to do the monetary valuation for cost benefit analysis. In the additional metrics, we have the OneWeb scale that's come up in the discussion today. That is a fairly prominent measure we found in these evaluations to date. There is currently no tool that allows you to directly map that onto a monetary value, but that could be a future piece of work. But in any case, I think it's a useful scale to continue to measure and report on to provide supporting evidence to the core metrics. And one thing that we've come across that there is language and narrative around it, but we've not really seen it in terms of metrics, is more around the capabilities side. So this is the Sen-Nussbaum type of capabilities approach to thinking about well-being, which is rather than the direct outcomes, people have the opportunities to improve their well-being. So this would look at more at things like autonomy, creative expression, opportunities to engage rather than the direct outcomes. And those have, we find, value in and of themselves as well. And some capability metrics like IceCap, which is again a multi-item scale, a bit like OneWeb's, has now been produced into an index that allows you to include that in certain types of economic evaluation, such as a cost utility type of framework. And so that's another area that we would be looking at to including in these types of metrics. So just to finish up and summarize, as I say, that's very preliminary thinking that we've kind of landed on at the moment, and it's really we're looking forward to engaging with the sector to develop the set of metrics that would work for the sector, and that would also provide the rigor required in the Green Book. Thank you.
Great stuff. Thank you, Daniel. And as Daniel says, this is really the start of the conversation really around, I think what Daniel was saying really there about, I guess that being able to articulate that offer, that creative health offer in those terms of both health, impact on health utilisation, but also those wider societal, economic, employability benefits is really important for the sector. So we hope we can start that conversation about what do those data sets look like and how can we best collate them. I'm very conscious of time and very keen to open us up. We've got lots of Q&A, but sadly less than 10 minutes to tackle it. So I'm going to dive straight in, and apologies if we don't get through all of these. We will attempt to answer them either in the next few minutes, or we will get back to our delegates. So I'm going to kick us off, if that's all right, team. Our first question is from Jaideep. Thank you, Jaideep. It says, thanks, Matt. This is really helpful in showing that the methods and evidence base are becoming established. The question now feels less methodological and more institutional, and the challenge is no longer whether these benefits exist, but how we make them legible within Treasury and commissioning frameworks. Could you say a bit more about engagement with HMT or the Green Book team to ensure approaches like this are recognised in formal appraisal? Really good question to Matt, but if anybody else also wants to jump in, please do.
Yeah, great question. Thank you. So I probably should have said, so alongside the report, in our kind of flagship report I touched on, which is called Embedding a Cultural Heritage Capital Approach, within that we include guidance on how we're applying the values across all of our research, not just the health and wellbeing stuff. And the intention is eventually for that to form part of the supplementary Green Book guidance. So we are talking very closely with Treasury about all of this work, as well as a load of other work we're doing as well. And they are very much on board with this approach and taking the welfare approach to measure some of these benefits. So yeah, we were speaking to Treasury quite closely, spoke to them last week on a separate project. So I think you're right, there are still methodological challenges, particularly around sort of longitudinal side of things and making sure that we've got robust data sets to capture all of the impacts. But I think you are right. I think now it's a case of how do we implement this, how do we kind of get this disseminated, and obviously Treasury are a key part of that, and they are very much engaged with it. So yeah, I think that's probably a more slightly longer term plan to get some of this as kind of supplementary guidance, but that is definitely our focus. Yeah, hopefully that's answered the question.
Does anybody else want to chip in there? Brilliant. Thank you. Thanks, Matt. Got a question from Dominic, who wants to know, I wonder how the speakers expect their work to be interpreted ultimately. Are they positive about change? And also a kind of preliminary question from Dominic about formative experiences, reading or scholars they think that led them to this work. Dominic would love to give attention to the values and causes which drive the sector's progress. So I guess underlying influence in terms of that have led to this work, and then how we expect it to be interpreted. Who wants to have a go at that?
I can have a very fast go, and probably I'm passing it back to Greg and Jacob from my end, possibly Rose as well in that vein. I mean, for me, the key thing is from a research perspective, from as a practitioner, as a clinician, as an art therapist, sort of the role of the arts has been, sort of not really fully acknowledged and not fully appreciated. The problem remains that no matter how much evidence is growing and what way and how much experience and exposure we have to change, we're faced with serious economic challenges, and we're faced with established practices that are not going to give way to other types of interventions unless there is an economic argument attached to it. So I'm coming in as a fairly somebody with no economic background whatsoever, coming from the need for arts and health to become known and valued. And I think the collaborative work with colleagues with a health economic background becomes important in that respect, because we can share experiences and find ways forward together and find ways of monetizing things. That's my contribution, which is very much coming from a research practitioner, clinician perspective. Don't know whether Jacob and Greg need to.
I guess I'll just ask, and I think, we've heard some of the brilliant work produced by colleagues in, sort of laying some of the foundations, the methodological foundations for being able to build an evidence base of the economic impacts. I think, there's a paucity of it to now, and I think, we've now got a way forward, and we've seen examples of this beginning to sort of blossom. So, but I guess maybe, and also likewise, I'm coming at this as health economists. Sometimes we're working on very different projects at the same time, so it can be very clinical, or it can be really interesting in the art space like this. But I think some of the comprehensive systematic reviews conducted by Professor Daisy Fancourt and colleagues have allowed for the subsequent calculation of these economic benefits, or the estimation of these economic benefits. So I think without that comprehensive collation of the evidence, a lot of our work wouldn't be possible. So that's probably a key individual in my eyes.
Thank you. I don't know if any other colleagues want to jump in. I think that point about that you make, Vicky, about selling that economic point is really important, in terms of we're definitely hearing that through our work through Mobilising, through our work through the National Centre for Creative Health, from commissioners, in order to speak that commissioning language, in order to be able to articulate our offer to health in its broadest sense. We do need to have this kind of evidence. And I think one of the challenges is what we know from the sector is that, how challenging it is to collect this kind of effort, the effort, the capacity, the resource in collecting the right kinds of data. We really don't underestimate that. That's, I guess, why it's so important to have research investment in this space, because we know that arts organisations do not have that capacity themselves, but we really need those organisations in the room to be able to have those conversations about what is practicable to collect. And, many of us have had many conversations about the use of things like WebWEMS and the challenges of implementing those kind of data collection tools, particularly with kind of underrepresented audiences, particularly in amongst a creative intervention where the activity, it can detract very much from the activity. So we don't underestimate the challenges of collecting these sorts of data, but we really want to try and capture all of that whilst giving the best sales value, if we can, for the offers that we're talking about.
And there is, if I may, Helen, there is a bit of a shift of thinking here. It's not a shift, it's an additional expansion of our thinking, because for the last 20 years, I spent my research effort trying to synthesize evidence, doing Cochrane reviews, doing sort of thinking about effectiveness. And now that's not enough. This in itself, we have gathered enough of that evidence to now also shift our thinking to the cost effectiveness and economic value in broader terms. So that's an interesting change for the sector, I think.
Thank you. We've got a question for you, Rosie. Can Rosie expand on which health and wellbeing colleagues in Wales are responding most positively to the evidence in the research?
Well, I suppose it depends what you mean by responding positively. I mean, I think personally, I see it in two categories. I think there's what health partners say, and we've had lots of positive feedback in that respect about the impact from people like exec directors of nursing, exec directors of quality, patient safety, from some of the value-based healthcare teams. You know, particularly in Wales, there's definitely a growing recognition amongst those people that something needs to radically change in terms of how they approach and fund. We approach and fund healthcare services, particularly in Wales, where we have an ageing population, and even within the next 5 years, demand and costs are going to far outweigh even where we're at now. So standing still is not an option for those people. And so this kind of evidence helps them to think in that radically different way. But I think that then the other way of understanding response is what those people then actually do, and whether there's any money actually moving towards arts from health budgets. And in Wales, it's really going the other way at the moment. The purpose and spend on NHS in Wales is grown massively, and even in the last few years, as a proportion of the whole. So there's what people say, and then there's what they do. There's more work to do as well from a data perspective from the Arts Council. What I really would love to understand more is how much money is actually going into arts, health and wellbeing work from health. It is happening. There are lots and lots of places where it's happening, and all of the projects that we fund are match funded through health as well. So, but we don't quite know how to quantify that yet. So there's still quite a lot more work to do to understand the full answer to what they're actually doing. But yeah, just to say that's how I would understand that.
Brilliant. Thank you, Rosie. Everyone, I'm really sorry we're out of time. There's loads of questions we haven't been able to get through, but the panel and I will look at those and get back to you as soon as we can. A huge thank you to all of our speakers. As you've heard today, this really is the beginning of the conversation. There'll be more events, workshops, roundtables like this where you can join in that conversation, and hopefully it can be more of a discussion. Thank you to all of you for joining us, and a special thanks to all of our panelist speakers. You've done a great job, and you've got the web link. We'll be emailing all of our attendees who signed up over Eventbrite, so you'll get the link so that you can go and watch this live and share it. But meanwhile, enjoy the rest of your day, and thank you for joining us. Bye, everyone.
Thank you, everyone.
Thank you very much.
Thank
Take care.
you.
Bye.